Hello guys, welcome to today's presentation on Hookworm and Nelson YouTube channel with Miss Cindy. So today's discussion we are going to look at hookworm diseases. Yes, we are going to continue with tropical diseases. So if this is the first time coming across this presentation or this YouTube channel, go ahead and subscribe so that you'll be notified each and every time that you post a lesson. So let's go on. So now our general objective of this lesson is that at the end of this discussion, you, the students, should be able to acquire knowledge on hookworm disease. Specific objectives as follows. You should be able to define hookworm disease. You should state the causes. You should describe the life cycle of hookworm. You should explain the pathophysiology. You should be able to explain the medical management and explain the preventive measures of hookworm diseases. So for introduction, we are saying hookworm is a parasitic nematode that lives in the small intestines of its host. And in this case, we are talking about the human host. When these worms enters into the body, they go and live into the small intestines. Then it is the leading cause of maternal and child morbidity in developing countries of the tropics and the subtropics. So in children who are at high risk of hookworm diseases, it causes intellectual, cognitive, and growth retardation. So this is how dangerous it is in children. It may alter their growth and development. So in pregnancy, it can cause prematurity and low birth weight among newborns, those babies which are born from mothers who are infected with hookworm disease. So let's look at the epidemiology. So it is estimated that between 760 to 740 million individuals are infected with hookworm today. So this information is according to the World Health Organization. And out of this number, about 90 million are severely affected with hookworm disease. So let's get started. So let's start with looking at the risk factors. What are the risk factors of one acquiring hookworm disease? So the first one is that bathing in water bodies into which sewage is deposited. So bathing into maybe bathing or swimming in pools or water bodies such as rivers in which they throw feces or sewage is a risk. So also becoming in contact with sewage water by workers or during rains. So for example, it's the rain season, people are farming. So in the areas where they throw sewage anyhow in the bush, so when a person becomes in contact with that soil which is contaminated with these parasites, a person may be at risk of having hookworm. Then also lying on a beach sand that is contaminated with human feces or feces which have got these parasites. As you can see, our little boy enjoying himself on the beach. So if this water is contaminated, this child is at high risk of having hookworm disease. So also walking barefoot in contaminated soil. For example, if you are at the farm, you're not putting on your protective gumboots, you are at risk of having hookworm. Then also touching contaminated soil in fields, for example, while weeding. Yeah. So as long as you are becoming in contact with soil which is contaminated with these parasites, you are at risk of having hookworm disease. So now let's move on to the definition. What is hookworm disease? How can we define hookworm disease? So hookworm disease or ankylostomiasis is a nematode disease caused by infestation with neither Ancylostoma duodenale or Nectar americanus. Transmission is by penetration through the skin by a flaviform larva or ingestion of the contaminated food. So that's how we can define hookworm disease. It is a parasitic disease which is also called ankylostomiasis. So it is caused by Nectar americanus or Nectar americanus or Ankylostoma duodenale. So these are the two parasites which causes it. Then transmission, it can be through penetration of the skin or through ingestion of contaminated food, water, or anything which is ingested. So now let's look at the causes. So the two species of hookworm which commonly affect humans are Ankylostoma duodenale and Ankylostoma duodenale and Nectar americanus. Yes, so these are the two species which cause hookworm disease in humans. So Ankylostoma duodenale, one. Second, Nectar americanus. So let's look at some more details on these two parasites. So when it comes to Nectar americanus, it's more predominant in America, Sub-Saharan Africa, East Asia, China, and Indonesia. So that's for Nectar americanus. More common in America, Sub-Saharan Africa, Southeast Asia, China, and Indonesia. While Ankylostoma duodenale it is predominant in the Middle East, in North Africa, India, and formerly the Southern Europe. So for easy remembering, you can just remember Nectar americanus from the word America. So Nectar americanus is common in America. Yeah. So Ankylostomiasis is a name which is given to a disease which is caused by hookworm. So Ankylostomiasis, which is also called helminthiasis, is a disease caused by hookworm. So in this disease, it comes about when a hookworm which is present, when these hookworms which are present in large number produced an iron deficiency anemia by vigorously sucking blood from the host intestinal walls. So in simple terms, we are saying that ankylostomiasis is a disease which comes about due to hookworm, and it comes about due to the presence of the parasites in the intestines, sucking up blood and destroying red blood cells in the intestinal wall. Yeah. So now let's look at the morphology, how these parasites are, how they are made. So when it comes to when it comes to Nectar americanus, when it comes to Ankylostoma duodenale, sorry. So when it comes to Ankylostoma duodenale, these worms are grayish or white in color with a head slightly bent in relation to the rest of the body. So we'll be able to see a picture of that. So they possess a well-developed mouth with a pairs of teeth. So this is how these parasites are. Then the male ones measures approximately 1 centimeter by 0.5 millimeters. The females are often longer. So these parasites, the females are a bit bigger than the male ones. And this is what we are describing. If you look at this picture, this is Ankylostoma duodenale and this is Nectar americanus. So this is the head. So they have well-developed mouths with the teeth here. You can see these teeth. So these mounts are the ones which attach themselves to the walls of the small intestines, so that they now start to feed on the things or the food which are found in the small intestines. So this is about the morphology. This is how they are. And as we can see, these two pairs, so the smaller ones is the male one, then the bigger one is the female one. So this is about the morphology. So we say they are grayish or white in color, with a head with its slightly bent in the relation to the rest of the body. They possess a well-developed mouth with a pair of teeth. So this is the teeth which makes them attach themselves to the walls of the intestines. And we have also seen that the male ones are smaller than the female ones. So now let's go on to look at the life cycle of a hookworm parasite. So this is the picture showing the life cycle of the hookworm parasites, which are Nectar americanus and the Ancylostoma duodenale. So from this picture, we are able to see that in the first stage, the eggs of these parasites are introduced in the environment by an infected person. So this it simply means that the infected person has got these adult worms in the small intestines which are producing these eggs. And then when these eggs are produced in the small intestines, they are passed on in stool or in feces. That's how these eggs are going to be introduced in the environment by a person who is infected with the hookworm. Then in the stage 2, we see that these eggs hatch. And then when they hatch, they produce a larva which is called labdiform larva. So when the egg hatches, it produces a labdiform larva. So during stage 3, this labdiform larva develops into a flariform, and this flariform is the one which is able to penetrate through the skin, or it may enter into a human body through oral route, through the ingestion. So when it is ingested, or when it passes through the skin, it will find itself in the circulatory system, go to the lungs, undergo development, then move up the respiratory tract, go on the epiglottis, be swallowed and be taken into the GIT. Going down the GIT, they'll move and come to the small intestines, where they'll start now growing and living, maturing, and start producing eggs, and the cycle will continue. So let's now look at the life cycle in details. So in first stage 1, we saw that Nectar americanus and the Ancylostoma duodenale eggs can be found in warm, moist soil, where they will eventually hatch into the first larva stage. So in short, we are saying the eggs are introduced in the environment by a person who is infected. So when these eggs are introduced in the environment, they'll be found in warm, moist soil. So during stage 2, when the egg hatch, it produces a first larva stage. So it says it is the feeding non-effective larva called labdiform, which was produced when the egg hatched, will feed on the soil microbes and eventually molt into second stage larva, which is also in labdid form. This one will feed for approximately 7 days and then molt into a third stage larva. So in stage 2, we are saying when the labdiform is produced from the eggs after hatching, it will be feeding on soil microbes, the soil bacteria. From there, it will develop into a second stage larva, which will also be feeding on microorganisms. So microorganisms which are found in the soil for about 7 days, and then it will develop to a third stage larva. So during the third stage, this is the flariform stage. So the first stage and the second stage was the flariform larva. So the larva was called the labdidiform. Now in third stage, it's called a flariform stage of the parasite. It is a non-feeding infective form of the larva. So in the first stage, it was not infective, it was feeding. Now in the third stage, it becomes a flariform, which is not feeding but very much infective. So this is the larva which is infective. It can penetrate through the skin. So this flariform is extremely motile and will seek higher grounds to increase their chances of penetrating through the skin of the human host. So the larva can survive up to 2 weeks without finding the host. So what we are saying is that during third stage, a flariform has been produced, and this flariform is very active, very motile, and it is not feeding. So this is the larva which is very much infective, and it is capable of infecting. It is capable of penetrating through the skin. So it is important, and it can be in the environment. It can survive in the environment for up to 2 weeks without finding a host. And that is a lot of time. So it can be in the soil, in the ground for 2 weeks without finding a host. So it is important to note that while Nectar americanus larvae only infect through penetration. So Nectar americanus only infect through penetration of the skin, while Aclostoma duodenale can infect both through penetration as well as orally. So for duodenale, it can be transmitted through both oral and penetration, while Nectar americanus is only through penetration of the skin. So in stage 4, after the larva has successfully entered the host, the human host, the host, the larva then travels through the subcutaneous venues and the lymphatic vessels of the human host. So if it entered through, let's say, the hand or the foot, it will move along the subcutaneous tissue until it finds the subcutaneous venues and the lymphatic vessels. So that's where it will be traveling, and eventually the larva will enter the lungs through the pulmonary capillaries and break out into the alveoli. So it enters the skin, goes in the subcutaneous tissue, into the capillaries, breaks out into the alveoli. So as it is traveling along the lymphatic vessels, it will eventually go into the circulation, portal circulation. Finally, it goes into the lungs and into the alveoli. So when it goes into the lungs, it will undergo some development. Then we go to stage 5. In stage 5, these parasites, the flariform, which is now in the lungs, it has gone some development. It will now travel up the trachea to be coughed and swallowed by the host. So it was in the lung where it underwent some development. So it will now move up the bronchial tree, move up the respiratory system, go into the trachea, up on the epiglottis, and then a person will feel like coughing. Then when they cough and they swallow what they cough, those parasites will be coughed now into the GIT system, where they will be swallowed in the liver, are then found in the small intestines, where they will molt into adult worms, or where they will develop into adult worms. So that is how these parasites morph and develop. So when they go into the small intestines, they will be enjoying themselves there, enjoying their food. As we know, the small intestines, that's where the absorption of the nutrients such as the amino acids, the glucose, everything, the fats, acids, everything which has been digested is in the small intestines, so that they are absorbed and the body uses these nutrients accordingly. So now when these worms are in the small intestines, that's now when the disease starts now. Yeah, so the entire process from the skin penetration to adult development will take about 5 to 9 weeks. The adult female worms will release eggs. So when they are in the small intestine now, they'll start meeting and they'll start producing these eggs. So for Nectar americanus, it can produce about 900 to 10,000 eggs per day. While Ancylostoma duodenale can produce about 2,500 to 30,000 eggs per day, which are passed in the feces of the human host. Now imagine this child has got these worms, and these worms are producing these amounts of eggs every day. So these eggs will hatch in the environment after several days, and then the cycle will start again. So that is the life cycle of a hookworm or hookworm parasite. So now let's move on to look at the pathophysiology of the hookworm infection. So hookworm infection is generally considered to be asymptomatic, but it's an extremely dangerous infection because its damage is silent and insidious. So in the first place, a person won't show any signs of the infection, so it will be asymptomatic. There are general symptoms that individuals may experience soon after the infection. So when the parasites have just penetrated through the skin, there will be itching, which is just an allergic reaction at the site of penetration and entry, which is very common with patients affected by Nectar americanus. Remember that Nectar americanus is transmitted through penetration into the skin only. Then additionally, cough and pneumonia-like form may result as the liver breaks into the alveoli and travel up the trachea. As you remember, we said during the life cycle, these parasites will go in the respiratory system, in the alveoli, where they will undergo some development, then they'll move up the respiratory tree, go on the trachea, on the epiglottis, and then they'll be swallowed into the GIT. So that process will cause irritation of the respiratory system. As a result, this person will be coughing and may have some pneumonia-like. So we'll continue. Then once the larva reaches the small intestines of the host and begin to mature, the infected person will suffer from diarrhea and other gastrointestinal discomfort. So now that the larva is in the GIT, they'll start irritating and causing the inflammation of the GIT. As a result, this person will have diarrhea, abdominal pains, and all those signs which are caused by inflammation of the GIT. However, the silent and insidious symptoms refer mainly to the chronic heavy intensity hookworm infections. So the danger of having this disease comes about due to the chronic heavy intensity hookworms which are found in the stomach. So the major morbidity associated with hookworm is caused by intestinal blood loss, iron deficiency, anemia, and protein malnutrition. So how this comes about is because the mature worms are present in the small intestines, and we know that in the small intestines, that's where the absorption of nutrients takes place. So because they are in the small intestines, and remember when we talked about the morphology, we said they have well-developed mouths which have tooth. So this tooth is going to bite into the walls of the small intestines, and they'll be sucking in blood. They'll be sucking in the blood and destroying hemoglobin, and that's how there'll be blood loss and iron deficiency, anemia. Plus protein malnutrition will come about due to the worms they'll be feeding on the food, the amino acids which are in the small intestines. So if it is a child or if it's an adult, instead of the body absorbing the nutrients which have been digested or which have been digested into the small intestine, instead of the body absorbing that, using it, the worms now are the ones which are going to be benefiting from those amino acids and other nutrients. As a result, a child or a patient will have malnutrition. Yes, so they result mainly from so all these problems will come about due to the presence of adult worms which are in the small intestines, ingesting blood, rupturing erythrocytes which are red blood cells, and degrading hemoglobin in the host, and that is how anemia will come about. So this long-term blood loss can manifest itself physically through facial and peripheral edema, eosinophils, and pica caused by iron deficiency anemia. So this is how this infection is very much dangerous, because we have these adult worms which are feeding on the blood and the nutrients which are found in the small intestines. So it is important to also consider that it is widely accepted that children who suffer from chronic hookworm infection can suffer from growth retardation as well as intellectual and cognitive impairment. Of course, as we have seen from the pathophysiology, we have seen that these worms which are in the small intestines are feeding on the blood and on the nutrients which this child has just taken in. As a result, their growth is going to be disturbed, because there is no enough food, there is no enough blood. As a result, the body will suffer. So that is the pathophysiology of hookworm disease. So now let's move on to look at the signs and symptoms of hookworm disease. So signs and symptoms are linked to inflammation of the GIT stimulated by feeding hookworms. So we said in the first place, when we look at the skin where the nectar americanus has penetrated from, so it means that there will be irritation and inflammation at the site of entry. So we have signs on the skin, we'll have the signs in the GIT, then we also have signs in the respiratory system, and we also have signs in the blood system. So starting with the GIT system, we are going to see that the patient will have nausea, abdominal pains, and intermittent diarrhea. So capricious appetite. So all these are coming about due to the presence of the parasites in the GIT. Then pica, which is dirty eating, comes about due to the anemia, due to the iron deficiency. anemia that this child or this patient is having. Then we also have constipation followed by diarrhea. This is due to the inflammation which is taking place in the GIT due to the presence of these worms in the gut. Then we have palpitations, pallor, and shortness of breath. So palpitations and pallor will come about due to the iron deficiency, anemia that this child is having. Pallor is because of anemia. Shortness of breath is because of anemia, and also the irritation of the respiratory system due to the presence of the parasites in there. So other signs and symptoms when it becomes chronic include signs of cardiac failure in severe cases, then slow physical and cognitive growth and development, especially in children. Then we also have hyperproteinemia, which is just low level of proteins in the blood, which will lead to peripheral edema. So if you remember very well, when we have low proteins in the blood, especially albumin, if albumin is not enough in the blood, it will lead to the fluids or water leaking out of the blood vessels and resulting into edema. So in this case, you are going to have peripheral edema due to hypoproteinemia. Also, we have also signs of infection such as fever, wheezing, and chest pains. So when the infection is long-term, it can cause iron deficiency anemia, presenting with pallor and all these other signs, hypothermia, snuffing nails, and tachycardia. So all these signs will come about due to iron deficiency anemia because the infection has been in the body for a long time. So those are the signs and symptoms of hookworm disease. Let's move on to look at the medical management of hookworm disease. So when we comes to diagnosis, so the first is the microscopic examination of the stool to identify the parasitic worms. So the stool samples will be collected from this patient to be taken to the laboratory where they will examine it, and they will be able to see the eggs of these parasites. Then we also the doctor also prescribed to do a full blood count. Full blood count can also be done to rule out anemia because of the disease process that we've looked at. So we're going to do also a full blood count. So also when it comes to treatment, albendazole is the drug of choice, which can be administered as a single dose at 400 milligram, or it can be given 200 milligram daily for 3 days, or this 200 can also be divided into 2 doses, being given at 100 milligram BD 12 hourly for 3 days. So albendazole can be given as a single dose at 400 milligram, then also can be given one time a day for 2 days by giving 200 milligram, or 2 times daily for 3 days, or being given 2 times at 100 milligrams for 3 days. So that's albendazole. Then when it comes to mebendazole, which can be given as a single dose at 500 milligram, is also very much effective. So the third drug is combantrin, which can also be given at 10 milligram per kg body weight. So when it comes to supportive treatment, especially when this child has presented with signs of anemia, or when the hemoglobin level is low, we are going to give support treatment of ferrous sulfate, which can be given 200 milligram 8 hourly by 3 months, or folic acid, which can also be given 5 milligram daily orally for a month. And also, depending on how low the hemoglobin is, the child can receive blood transfusion as supportive treatment. Then also oxygen may also be given if this child is having difficulties in breathing due to anemia. So when it comes to prevention and control of hookworm, we have to make sure that we improve the sanitation of the area where hookworm infection is prevalent, then improve socio-economic conditions and educating people about the disease, conducting school-based or community-based deworming programs. So pests like dogs and cats also should be dewormed, then provide adequate clean drinking water and tap water for other users. They're not using human extract as fertilizer. So farmers should be encouraged or should be discouraged from using human extract or slow sewage for agriculture purposes. Okay, so all these are preventive and control measures. Then the community should be educated on not defecating in open spaces, but to use toilets. Also, washing of hands should be encouraged, and people should stay away from areas which are contaminated with human feces, and then we have to improve the overall health of individuals. So here, this is where we've come to the end of our lesson today. Hope you have